I have a girls' weekend planned and I want to get Botox the morning before. My injector said no alcohol for 24 hours, but I read online that some people drink right after Botox with no issues. Is the alcohol restriction based on real science or is it just liability protection? So there's real science behind the alcohol restriction, though the risk is cosmetic rather than life-threatening. Ethanol is a vasodilator and a platelet aggregation inhibitor. In other words, alcohol widens your blood vessels and makes your blood less likely to clot. The practical consequence is bruising. Each Botox injection involves a 30 or 32 gauge needle puncturing through skin, subcutaneous tissue, and into muscle. These needle tracks create tiny vascular injuries that normally seal within minutes. When alcohol is in your system, those micro-injuries take longer to clot, and the extravasated blood that leaks out of the vessel spreads into surrounding tissue as a visible bruise. Bruising after Botox is the #1 cosmetic complaint I see. It's not dangerous, but a purple-green bruise on your forehead before a weekend getaway is exactly what you're trying to avoid. That is why the 24-hour guideline exists. At DermMavenMD, I recommend avoiding alcohol for 24 hours before and 24 hours after injection. I also recommend pausing blood-thinning supplements like fish oil, vitamin E, or ginkgo for 5 to 7 days prior, as these amplify the same coagulation interference. If your timeline is tight, here's what I would suggest. Schedule your Botox 3 to 5 days before your trip rather than the morning of. This gives the toxin time to settle, any potential bruising time to resolve, and your results to develop before your plans begin. I would rather adjust your appointment timing at our Madera clinic than have you spend your weekend covering a bruise with concealer. Planning around your social calendar is part of practical patient care, and I factor that into every treatment.